Good afternoon, and happy before Thanksgiving and happy before Christmas. We're here today with Dr. Kenneth Hepburn for the Emory School of Nursing, who's going to talk to us and provide for us some caregiving tips about how to survive the holidays. Dr. Hepburn is Dean of Research at the Emory School of Nursing, but he's also devised and developed a curriculum on how to be a better caregiver. So at this time, Dr. Hepburn, what kinds of things should we be looking out for when we're taking care of somebody who has Alzheimer's or other dementias during Christmas? What shouldn't we do?
So the first thing I think everybody who's a caregiver has to do is to really look carefully at the person with whom you're working, who's living with the disease, and try to understand what she or he can do and what she or he likes to do. You can think about what the person likes to do in terms of her history, especially around Thanksgiving and Christmas. These are or the holiday seasons, because these are usually very special times for people. So what did the person like? Did the person like big family dinners? Did the person like to go to religious services for Hanukkah or Christmas? Did the person like to go shopping? So if the person liked to do those things, that gives you sort of a clue. These could be things in which to engage the person. But then you have to think, so how much now, given what the illness may be doing to the person, how much can the person handle? So is a big family Thanksgiving dinner with all the great-grandkids and grandkids and kids and uncles and aunts and everything, 35 people around the table, much as the person used to love that, is that still something she can handle? Is it going to be too much? Is it going to be just right? So if you judge it to be too much, think about some alternatives. Think about what one family we worked with is doing, which is to have a series of family dinners, but smaller family dinners. So one family comes one weekend, another the next weekend, and so forth.
So on that note, Dr. Hepburn, when you say smaller rather than larger gatherings, and I know the tendency is for us, particularly in the Southeast, to have these large family gatherings, tell people why maybe that's not such a good idea.
Yeah, so that's a great question. When an illness like Alzheimer's begins to affect a person, one of the effects it has is to reduce the person's capacity to deal with a lot of stimuli. Now, the rest of those of us who are not dealing with these illnesses maybe can juggle lots and lots of balls. When we do that, we also know when it's getting to be too much, and we have mechanisms for scaling back. But that capacity to know it's getting a little over the top and the ability to scale back, that's also being eroded by an illness like Alzheimer's. So the person doesn't know that it's too much, and the person can't scale back, and it gets to be too much, and then that can produce a reaction. It might produce a reaction of just wanting to curl up into a ball and go away, just leave the room. Or it might be a little bit more aggressive, like tell those kids to shut up, something that Grandpa would never do, Grandma would never do. Mm-hmm. But that capacity to say, well, what's getting to me, that's going away. So that's what I mean by too much.
And on that note, when you start talking about too much stimuli, lots of people who they may not recognize can be fearful. But the other thing is, I say noise, like loud noises can be kind of frightening to people.
That's, like loud noises at a mall.
Ah.
Go to a big shopping mall, and you're surrounded with piped-in music, often very loud, and lots of people coming at you from all sides. Lights flashing. These are all things that when we go to a mall, we sort of assume are going to happen. If powers are diminished by an illness, you're not prepared for that. Mm-hmm. And you, again, may react.
Mm-hmm. The other thing that seems to be of concern when it comes time for Christmas, everybody likes spirits of one sort or another.
Mm-hmm.
If you have an older relative who has dementia and seems pretty stable, is it okay for them to have a glass of wine or to have a cocktail?
Personally, I hope so, but I think that's the kind of thing that a savvy caregiver, which is the name of our program, should try and figure out in advance. Sort of what happens if the person, just in an intimate situation at home, just with the caregiver and the person, has a cocktail. What does the person do? If you notice that the person becomes more disinhibited than you think is appropriate, or that person would have thought was appropriate, perhaps it's time to create mocktails for the person. Fancy drinks that fizz and have straws and umbrellas and whatnot, but don't necessarily have alcohol in them.
Okay, all right. That's a really good tip, because everybody wants to know. Everybody's, don't let them drink anything. You have to make sure that you give them their medicines, but we don't want to have a problem with alcohol. Right. While we're talking about dementia, there are families who aren't aware, or let's just put it this way, aren't really sure that somebody has dementia. What sorts of signs and symptoms that people should look at or look for? Here's a question from some of you. It says, my family's in denial. I guess that means that somebody has signs and they're bringing several people for dinner. What should I do? What should we do? Because a lot of families have not had this discussion.
Denial is awfully common. First of all, we don't want this to be happening. Mm-hmm. So it's a kind of a wish that this isn't happening. That sort of emotion-focused response is often counterproductive, but it happens. So some things to do about denial, I think, are to get maybe some documentation from a physician. It's that Ma has dementia. Mm-hmm. And if you want to, don't fight with me, fight with the doctor, because I got too much in my hands as a caregiver anyhow. So, but anyhow, they're going to bring the family. There isn't a lot to do. If they're bound and determined and they have airline reservations and are going to show up, one of the things you can do is to scale down the scope of the dinner. So we talked about what do people like to do. Mm-hmm. I think we probably both love to prepare Thanksgiving dinner or Christmas or when to cook. Mm-hmm. Involving the person in cooking can be very engaging, but it can also be tiring. Mm-hmm. And so if you have a smaller scale dinner and involve the person less in dinner, he or she may have better reserve for managing a larger crowd. Mm-hmm. Best thing is to try to cut the family off at the pass with information. Mm-hmm. And use of another authority figure like a physician or a pastor or a rabbi. But then the other is to tone down the dinner itself. We were on a topic before about I lost track of it.
Well, I want to get back to this one with respect to denial, because it's usually during holiday times that families do notice that there are changes. And some of the symptoms that we're talking about are repeating things, repeating the same stories over and over, asking the same questions over and over. Those things may be kind of subtle, but if you are observing that somebody is repeating things, or maybe they haven't paid attention to their hygiene, this would be a time to think about or have a family discussion about making sure that the person who is doing that gets some medical attention and medical evaluation.
Yeah, I think there's several important points that you're making. One is the kind of illnesses we're talking about, dementing illnesses like Alzheimer's and vascular dementia, are not normal aging. So normal forgetfulness, like I just lost track of this conversation, I hope is not a sign of dementia. Forgetting where I put my where I put my glasses, that's not a sign of dementia. But if you observe these things and there's a pattern, that's one thing. Another way to think about it as well, if the person's really good at something that's quite complicated, like fixing a big dinner, and begins to show signs of not being able to handle that or making really big mistakes, that's a significant sign. But the other thing I really liked about what you said is if a person begins to see this, and really it's more than just a nagging suspicion, beginning to discuss it with the family before even going to a physician and getting a diagnosis begins to lay a framework for more family cooperation and belief. I think that's quite important.
And I think I like your statement that this is a time for families to kind of be on the same page and cooperate and agree to help one another. So one of the questions from one of our viewers is, how do I get other family members to help me? Well, Dr. Hepburn has a caregiving training program that he can tell you more about, but one of the things that we need to remember as caregivers, we want help, but we also have to appreciate that we have to accept the help that people offer in the manner in which they do it.
Right.
You know, if you're the daughter and you're type A about how perfect mother needs to look, you're going to be frustrated if somebody else takes care of your mother and doesn't dress her the same way you do. So can you help us with how we can get other family members to help?
So I think the world is full of people who say things like, oh, what a terrible situation, let me know if I can help. Mm-hmm. And the really savvy caregiver has to be able to immediately respond, thank you, and here's what you can do for me. So the best thing that you can do is to know exactly an activity that the person really likes to do, that it's relatively easy to set up and get the person involved with. And when someone offers to help, say, if you can come over at whatever the best time is and help so-and-so to get involved with this, I'll show you how to do it. It'll only take you half an hour, so a small dose, and let the person come in and have a success. Because a lot of times people are afraid. What is this dementia? And I don't know how to handle it. We train people, we train caregivers in how to do that, but we also train caregivers to train others to be successful in small ways so that they'll offer larger amounts of help.
Can you talk a little bit about the Tele-savvy program in terms of how somebody can, before Thanksgiving hits next week, we can be a little bit better informed? We probably can't do everything, but can you tell us something about the Tele-savvy program?
So the Tele-savvy program is a research project that we have that's sponsored by the federal government, and it is testing a fully online caregiver education program. Anyone who's interested in this, and I'll give you a phone number and we'll post the phone number, would be involved in 7 consecutive weekly video conferences that last about an hour and a quarter, an hour and a half. And in between the video conferences receive daily video lessons, short video lessons from a variety of faculty members on how to undertake the role that of caregiving and to be very successful at that role. So it's not something that can happen between now and Thanksgiving. You could sign up between now and Thanksgiving or any time thereafter. But it is a research project. You would either be asked to immediately participate in Tele-savvy or to wait 6 months and then participate in Tele-savvy. But whoever signs up will eventually get into Tele-savvy.
There are other options too. You can kind of go on the website and look at the Alzheimer's Association website, and they have classes and tips for doing certain things with family members at this time. So the Alzheimer's Association website also has information, as does the Alzheimer's Foundation of America. Now, one of the questions that one of our viewers brought up is, what about caregiving support groups, and how can they help somebody who's taking care of somebody with Alzheimer's or other dementia?
So it's good to know you're not alone, and that's one of the important functions of a support group, is to understand others are in the situation. Sometimes you can get good tips on specific things, or tips like Dr. Parker just gave. Here's a great website, go look at it. One of the websites I also suggest is the National Institute on Aging, Alzheimer's Disease Education and Resources, ADIR. So that kind of not being alone, getting tips for resources and other resources in the community, those are useful things to do.
Mm-hmm. Other than classes, I mean, caregiving support groups help people kind of like find camaraderie and identify a community where all the people have similar complaints, and you can find some companionship in that. But the other thing that's good about caregiving support groups is they help you identify resources that may be right in your community.
Right.
For example, there may be a transportation service or I hate to call it, with smaller children we call it sharing babysitting, but like group sitting kinds of operations where people will help you during the holidays. And different churches have different things going on. But the main purpose for going to a caregiver support group is to understand that you're not alone, but also to find out what else you can do to help yourself and the person you're caring for.
I think another thing that they're useful for is it reinforces the notion that this is tough work, and you have to take care of yourself, and that it's okay to do that you can give yourself respite, that you can give yourself some things for yourself. A lot of times caregivers just burn themselves out, and it's very important to maintain self-care.
And a local caregiving support group can do that, but the Tele-savvy program that you just talked about doesn't require that you have to live in Atlanta.
No, this is a national program. We have participants. We've already signed up participants from Maine to Hawaii, and in fact we have somebody from Manitoba, Canada.
Oh, really?
Yeah. So the reason we did it, we offer here at Emory the Savvy Caregiver Program, which is an in-person caregiver education program. But even people living in Atlanta, to get from one place to another in Atlanta can be a nightmare for transportation, and also having to take care of the person. So there's no cost involved to Tele-savvy because it is a research program, and we're going to ask. Well, I'll tell you what the cost is. The cost is your time. Mm-hmm. We're going to interview you. We want to interview you 5 or 6 times. But in respect for your time, we have a small reimbursement we'll provide to you for that time spent in the interview process. But for the program and the program materials, no cost at all.
Great. I think, can you give them that telephone number right
now?
Yes.
The phone number... person who is the project director is named Katie Kilgore, and like Dr. Kilgore, and that'd be Dr. Kildare. Mm-hmm. The number is 404. It's an Atlanta number, 712-9578. 404-712-9578.
Mm-hmm. It says, okay, what about the care recipient? How do I manage behaviors? Now, there's a twofold part to that. You have to understand where the behaviors are coming from. Are the behaviors new and coming as a result of what's going on? Or is this something that they've had all the time? I always tell people if somebody has some bad behaviors like wandering or being obstreperous or particularly agitated and maybe a little violent, that those are habits that they didn't just get. And those are things best discussed with your primary care doctor or the geriatric psychiatrist. I think that we have to probably be a little bit more specific with behaviors, but as people advance in their dementia, they will have different behaviors. And some of those behaviors are bad personalities, such that they're argumentative. It could be wandering. It can be not sleeping well and getting up a lot in the middle of the night, but those things don't happen just during holiday time. They happen all the time. But again, you need to discuss those behaviors more specifically with your provider so that the provider can assist you. I do know that when people suddenly become irritated, they may be in pain. They may have an oncoming infection that needs to be addressed by the doctor.
There are really two sides to thinking about guiding or managing behavior. One is, this is a behavior I would like to have happen. I would like you to get dressed. I'd like you to wash up. And the other is, something is happening, a behavior is occurring that looks very uncomfortable, and I wish I could stop it. So that I think it's important to make that distinction. But in both cases, some things to think about are what's going on around the person. Are there too many stimuli or too few? Mm-hmm. Have I set things up, or can I set things up in a way that is a little bit more manageable for the person? To your point, Dr. Parker, is there also something going on internally? Is the person in pain? Mm-hmm. Is there something going on that the person is trying to express through her behavior that she can't talk about, that she can't say or even acknowledge? And so is the agitation or the withdrawal or distress meant to be telling me something that's happening? So how can I read it? So to answer the question more briefly, first understand, do you mean managing behavior prospectively, I want this to happen, or reactively, I want to try and calm this down? The second is, what's going on and how can I reshape what's going on around to try and accomplish it, and how to set things up. And then the third is, how do I talk to the person? You know, we're talking in these long, complex sentences, mm-hmm. and kind of gesturing to one another and nodding and whatnot. Think about in a dementing condition, that way of expressing yourself becomes less and less effective, and so you might have to use gesture and touch and pointing in ways that you aren't used to with that, particularly aren't used to with that person. So changing your way, knowing how to change your way of communicating becomes important.
Can you tell the caregivers who may be looking what they need to do to take care of themselves? They're fixating on the people they take care of, but what can we do to make sure that these people take care of themselves first? Self-care.
So it's you've all been on, most of us have been on an airline, and the stewardess comes, or the flight attendant comes on and at the beginning and says, now, under unusual circumstances, these masks may drop, and if you're with a small child, be sure to put your mask on before putting the child's mask on. You're in a situation like that. The masks have dropped. This is a caregiving situation that's going to go on for a long time. And you got to recognize that if you become ineffective, you're not going to be helping the person that you say you're helping. So there's that kind of, if I want to be a caregiver, I better do this if I want to be a caregiver. The other is that it's just important to recognize how punishing caregiving can be. That compared to others, you're going to be twice as likely to get physically or emotionally ill. Your whole system is compromised. So you are in a condition of threat. So recognizing that, you need to respond. You need to say, it's just flat out important that I do this. There are lots of things you can do: physical activity, meditation, spiritual activity, reading, intellectual activity, social interaction, or just going out and getting a haircut or getting your nails done or a massage or taking a walk. But make a list of things that you like to do, and then assign yourself something to do at least on a daily basis, if not more frequently.
Thank you, Dr. Hepburn. I appreciate that part of self-care, but the other part of self-care, and this is my last point here, is that you need to be sure that you've gotten your flu shots and your pneumonia vaccines at this time of year, because you with the flu or your care recipient with the flu is not going to be a happy picture. So please be sure to get your annual flu shot, and if you've never been given a pneumonia vaccine, we want you to have a pneumonia vaccine.
Great.
With that, I want to say thank you, Dr. Hepburn,
my pleasure,
for participating in our weekly wellness series, and thank you all for listening. We are going to be posting the Tele-savvy number and address again at the end of this program. But again, thank you so much for listening. Refer to our Tele-savvy program, but also look at the Alzheimer's Association website and National Institute of Aging website for tips on how to survive the holidays as a caregiver. Thank you.